Question 1. Why do some states require a test for antibodies against rubella for women before issuing a marriage license? And some states require a blood test for antibodies against rubella for women before issuing a marriage license to ensure that the woman has been vaccinated against rubella. And once a woman is pregnant, a rubella infection during pregnancy can lead to birth defects, it can lead to premature delivery, or it can even lead to fetal death. So from a public health standpoint, ensuring that a woman has been vaccinated against rubella is very vital to ensuring that low infant mortality rates exist. Question 2. A patient has been diagnosed as having pneumonia. Is this sufficient information to begin treatment with antimicrobial agents? Briefly discuss why or why not. So pneumonia is a general term used to describe pulmonary infections of the alveoli. Pneumonia can be caused by viruses and it can be caused by bacteria. So if you treat a patient with pneumonia that's caused by a virus with antimicrobial agents, then you can be actually doing more harm than good. So only knowing that someone has been diagnosed with pneumonia is not sufficient enough information to begin treatment of any kind, whether it's antimicrobial or antiviral. Question 3. Why might the influenza vaccine be less effective than other vaccines? So the flu is an RNA virus, and these viruses do not have RNA polymerase to proofread the RNA molecule that makes up their genetic material. And so this makes the flu virus very susceptible to mutations to its genetic material. And with so many mutations, your vaccines aren't going to be as effective because you'll have multiple strands of the virus that are present in the population. So one vaccine for the flu is not going to be effective against all the different strains of the flu. And so in contrast or comparison to another vaccine for, say, rabies, where you have one strand of rabies virus, the flu vaccine will not be as effective as a rabies vaccine because the flu virus is highly susceptible to lots of mutations.